is Janice McMahon. I am a full-time associate professor at ICO and a full-time clinical faculty at IEI. So when I started here, I was doing a little bit of everything. It naturally kind of developed that I enjoyed the clinical care, the one-on-one with the students. The education of the patients is by far my favorite thing, and what I hope shows up most in my clinical care. I really tell almost every patient they are your eyeballs. I want you to know as much about them as you wish. And if I pass that on to my students as well, I think they will become better clinicians and educators and doctors by talking with their patients and having a conversation rather than a one-sided list of things to do. There have been many ways that I have seen ICO grow over the years. I think the quality of student has definitely gotten better. There are so many more students who have done so much more than I did. They've worked in offices ahead of time, they've teched, they come in with all kinds of knowledge. One piece of advice I would give to students is to ask as many questions as they can of as many faculty members as they can, because you don't know where you're going to find that nugget of information and education and what you're going to pass on to the next person. I love our patient base. I feel like I can come into work every day and it's a little bit new. One day I'm in pediatrics, one day I'm in geriatrics, one day I'm in primary care. You can go wherever in this clinic and have just an infinite number of patients and diseases and things to choose from. And I really do like the variability. I like showing students that everybody is an individual and you have to treat them as the person in your chair, not as a statistic or as a disease, but really as an individual that has to go home and live with whatever you tell them they have. Optometry is very rewarding. It's one of these careers that I have never regretted for a minute. You kind of know what you're getting into. You know that you could be on call, but you don't have to be. You know that you could do medical optometry or binocular vision. You know that there are enormous opportunities to work part-time, full-time, more than full-time. And the possibilities are what keeps you moving forward, because it's not a stagnant profession at all. It's very dynamic and you can change to do more of what you like about it. And that puts you at a very good place so that you're satisfied with your career and what you do on a day-to-day basis.